Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, it is hard to believe, but it's already time for our back to school show.
Yay!
Why are you excited? Your kids are leaving?
I'm going to send them back to school. Are you kidding?
Okay, all right.
And here to help parents and students get the school year kicked off right is Mayo Clinic family physician, Dr. Summer Allen. Welcome back to the program. It's great to see you again.
Thank you guys for having me.
Dr. Allen, nice to see you. So you've got a couple kids, don't you? You got them ready?
I have two kids, and my son is starting second grade, and my daughter is still doing the pre-kindergarten. So one more year before kindergarten.
See, they're excited to go to school when they're that size. Mine, not so much.
I'm sure. Well, how do you get them prepared? What do you do as an expert?
So, especially at their age, one of our biggest things is the sleep and getting them back on a routine. Because between vacations, my parents are here, and for most kids, and again, it's so nice outside. They're wanting to enjoy, since we've had rain most of our summer, enjoy as much time as possible. So really starting to get a consistent bedtime routine and trying to get a consistent time that they wake up. And we have recommended timeframes really of amount of sleep that kids should be getting. So for our 6 to 13-year-old kids, we typically recommend around 9 to 11 hours of sleep. And then for 14 and older, 8 to 10 hours of sleep.
And how many weeks in advance, days in advance before the beginning of school should that you know, because you've got good intentions of doing it, but really when should you start?
You know, in reality, it would be great to give it a few weeks transition. I think for most people, it's probably, we're lucky if it's the week before school starts that they make that transition back to that routine.
Again, with teenagers, even harder. We're at the stage in my house where I am the first one to go to bed now, and those teenagers are up way later than I am. And so, and wanting to sleep in a whole lot later than they're going to need to be going to school, hours later. So probably even, I should start that a little bit earlier. Okay, I will.
All right,
I'll try.
yeah, you will. It won't work.
No,
but it's worth
I'll
trying.
try.
Yeah. So let's talk about a health checkup. Which kids need a health checkup, and when do you see them? What do you talk about, and what tests do you get?
Great questions. So typically for our children by school age, so after they've had their 5-year-old well child, we typically share with them that the checkups go about every 2 years, or the odd years, tell them. So 7, 9, 11 years old. And it gives us a good frame time to complete sports physical forms if they needed, to check in on academics and how they're doing. From an immunization standpoint, for kiddos, there's their kind of pre-kindergarten or pre-start to school immunizations, and that's anywhere between 4 to 6 years old. And then after that, the next one really starts at 9, which is the HPV vaccine. They can get as young as 9 years of age, or they can schedule it with their 11-year-old well child in immunizations, because at 11 years old, they'll get their tetanus and their meningococcal vaccine at that point.
So they get a meningococcal vaccine at 11.
They do.
You a proponent of HPV?
I am. You know, I have told countless parents and families when they've asked about it that often, again, these things were developed. They're not a protection against everything, but it's a step in that direction to help decrease these cancers that we're seeing in young adults and older. And so that's why it was developed. And I think, again, the iterations of it now have led to even more strains of the HPV virus to be covered. I think I understood people's concerns initially when it came out, but a lot of those concerns that people initially had have all been resolved. And so I recommend it to all my patients. And again, now it's down to just 2 shots. So they do one and then good. 6 months apart.
And it's not just the cancers that can develop from human papillomavirus. We recently learned from Dr. Poland that 25% of American adults have genital warts.
Yes.
Do you see those fairly
Yes.
frequently in your practice?
We do.
And do you treat them there?
So we can. It depends on the extent of them. Some become far more extensive and invasive for patients where they've got several. And so then in those cases, we might send it to one of our specialists, but we can treat them in our office as well.
Any tests that you need to get for at any of these ages? I mean, like a chest x-ray or blood work, or is it just pretty much talking physical exam and blood pressure?
Great question. No, typically what we're checking at these well child visits is usually blood pressure, pulse, height, and weight. So following on the growth curve, really trying to make sure that we maintain healthy body image is another thing for our young children and adolescents that we try to monitor as well. And from both extremes. So monitoring for early signs of obesity, but also for some who may struggle with being underweight or some unfortunate body image concerns. We want to try to track and follow that.
Probably not everyone who's listening or watching this on YouTube it has a Mayo Clinic physician like I do for my children. Is it a standard that when those kids hit 13 and 14 that the parents are no longer in the room when these exams are taking place? I mean, I think that's a big deal for kids to be able to start taking ownership of their own physical health.
No, exactly. So I actually even started, usually by my 7-year-old and 9-year-old well child visit, I start talking with the young children and with their parents present that when they come to future visits, there will be times where I'll ask their parents to step out. And or I also, and I say right in front of the parents so they're aware as well, that I can be a safe place. I talk to them about, are there any concerns they have with kids at school or with teachers at school? Do they have someone they feel they can talk to? And if not, that they're always welcome to come and see me. And I make it clear to them up front that if they ask, and I usually tell these young children, I say, you can just say, I need to go talk to Summer. Mm-hmm. And that when they come in, that I'll ask their mom or dad to step out and we can chat. And as long as I know that they're safe, that what we talk about stays between the two of us. If I'm worried about their safety, and then it's always cute. You can tell when they've had those talks. Some of them go, yeah, we heard that at school. So if we're going to hurt ourselves, you have to tell them. I said, yeah, just to make sure you're safe. But they've heard, and it just tries to, again, create another place that they can come to talk if they're concerned.
Something else that I have noticed is these visits begin with a mental health screening. And is that a standard across the country, or is that something that's just a Mayo Clinic standard?
That is becoming a standard across the country, and that's increased because of the awareness to mental health challenges that are occurring in our adolescents, and that we have, unfortunately, likely not screened and caught these early enough. So yeah, we're starting routine screening.
Tell us about that screening tool. What is it? Explain what it is.
Great question. So we utilize a PHQ-9M is the one for adolescent patients, so for those 18 or under age 18, and it's similar to what some have seen or what is used in adults, which is the PHQ-9 or even the PHQ-2 initial screener, and it tries to ask about feelings of feeling hopeless, sad, depressed, lack of or loss of interest in activities. It asks in the PHQ-9M, it tries to ask about self-injurious behaviors or self-injury, specific times when they may have thought of harming themselves, even if they haven't actively have a plan or thought most recently, but just in the past have they. So again, to try to trigger that this may be something that was more acute in the past, or again, in their age group that they may not be able to as astutely kind of describe, I'm depressed at this point.
I have a question. 14, 15, 16-year-old girl calls your office, wants to see you. Parents are not there. Ask for birth control. Do you give that prescription to them or without talking to their parents?
Another great question. They have that opportunity. So that is by law a right and availability for an adolescent patient to seek contraceptive support and care. Now, do they tell their parents, or what conversation do they have about that? I always encourage them to make the right choices and smart choices to keep themselves safe. But we also talk about how would they have that conversation, because there's certain things that I can't do from a screening perspective. So if they're coming in and they're sexually active, I can do a screening for gonorrhea and chlamydia, but it shows up pretty clear on mom and dad's insurance, medical insurance, that that's what they were tested for. And so how would they have that conversation with them? And so if they're uncomfortable and unable to, I want to make sure they're safe. So then we talk about the other places that they could get that testing done, or other places where they could get support for contraceptive things, at cost, and not have to use their parents' insurance.
Well, and not just contraceptives, but just talking about safe sexual practices.
Yes.
That's something that we did not have back in our day that you do now with patients.
We do. And I think a lot of times there's this philosophy. I was talking with someone about, let's avoid it till they ask about it. You don't really want to avoid talking about it until they ask about it, and trying to have a more open ability. And I think it's, for some parents, feels uncomfortable for them to talk. So that's why I start that conversation early about feeling pressured about things or being asked about things that maybe makes them feel uncomfortable, and that they can come and chat with me if they have concerns. And
this is a long way away from getting ready to go back to school. So maybe going back to school is just a good excuse to get patients in the door to just talk about their health care.
Exactly.
Dr. Summer Allen is a family physician at the Mayo Clinic. We're talking about going back to school, which is not that far away. Time for a short break. When we come back, I want to ask you about some homework tips, talk to you about healthy eating, ask you some questions about how you get your kids to eat healthy, and probably most important, I want to ask you both, screen time.
Oh, Lord.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We are with family physician Dr. Summer Allen. We're talking about some going back to school, some tips from an expert. So let's go right to schedules. And when it comes to schedules, I'm sure it's important for the parents to try to stay on top of that. But there are apps that you can get in school calendars where you can stay on top of things, right? I'm asking both of you.
Yes.
Yes, it becomes how many apps or calendars do you want going at once? I think for some.
How far do you want to get into what your kid is doing at school is another. That's a big change for what it was like when I was a kid.
Absolutely. I know a lot of schools now have online basically repositories for where you can go and access what assignments they've completed, what assignments they haven't, what activities are upcoming, and sort of their check-in process through that. You know, when it comes to staying on top of homework and activities, I really encourage parents early on, again, within their developmental age and appropriateness, but to start work plans and allow your child to start to manage and control this and understand, okay, I've been given an assignment, here's where it's due, and start to practice with time management and deciding based on what things they have due, what do they want to do first? Sometimes some kids will choose the thing that they enjoy most to do first. Others are going to choose that thing that's most challenging to them so then they can check it off the list and be done. But allowing them to start to manage this on their own, because as parents, if we control it all for them, we don't achieve the ultimate goal, which is what I tell parents is that we want to raise independent, caring, responsible adults. And so we need to set up a situation where they can be successful.
When my kids were in middle school, I just figured out that nothing is counting on their GPA that you're going to do when you're in high school. And I said, middle school, 5th grade, that's the time to let everybody fail. Like, you stop running stuff to school. You don't just let them fail, because otherwise they'll never learn how to do it. And then if you're worried about grade point averages, that does happen in high school. But if you let them fail in middle school, that's a better plan, possibly. Did I do the right thing?
No, absolutely. Well,
Time will tell.
Not that they're longer there.
Well, the other part of it is, and again, all of us witnessed it and experienced that, again, that urge to save them from everything, protect them from everything. But then, you know, I still remember the people in high school whose parents were still running because they didn't get the perfect grade point average and talking to the teacher and so starting early when they do fail, okay, well, what are some solutions they can think of and a lot of times it's going to be talking to the teacher, but having them do it. They by default want us to do it. They don't want to have that conversation about why they didn't bring their homework or why they missed it, but it's trying to start early with encouraging them to seek help, and doing that on their own will help them develop that skill so when they get to high school and beyond that they know how to manage it.
But I do think it's important to meet your kids' teachers, don't you? So that if there is a problem that you need to discuss with the teacher, they know who you are, or they at least have met you.
Absolutely. And keeping an open line of communication around what are our strengths or what are opportunities. I know even for my husband and I, we've always been fortunate and I've made an effort to meet our son's teacher and daughter's teachers right away. And that it's open, again, they see anything that they're concerned about to let us know.
Sure.
And my son, again, at his age was more behavior stuff. But when that became a repetitive thing, we talked about, okay, well, what's something where he can own? And it started to be a check sheet that he had to get filled out by each of the teachers. And he had to see how they rated his behaviors. And so it became something for him to own, though, that he had to take to each of the teachers and bring home to us at the end of the week. And when they weren't all 9s, trust me, my husband and I were asking him why they were not 9s.
Oh, it
I
goes
like
on
that
forever.
plan.
Yeah, I had one of those. Yeah, turned out to be a great kid, though. Yeah, they all get through it.
Before we get to screen time, let's talk about eating. Let's talk about healthy eating, because possibly also just like sleep during the summer, maybe they haven't been eating so healthfully.
Exactly. The thing we need to remember is sleep and eating are both fuels that our body needs in order to function. So starting the morning off with getting a meal in that gives them some protein that's going to help sustain them until their lunchtime is really important. It's hard because so many people are busy. It's hard when you can't get them out of bed to get them to get a decent meal in the morning. So trying to find those meals or those opportunities that will give them some protein and help sustain them until their lunchtime and give them the energy they need to get through their school day.
And what about fruits and vegetables? You force feed them, or what do you do with your kids?
So that's a really good question, and I am actually going to reference what my colleague asked my son, how much fruits and vegetables he was supposed to have, how many servings. And after she asked him the number of servings, she said, "Who's responsible for that?" And he looked at mom and dad, and she goes, "They're responsible for supplying it. You are in control of what you eat." And that mindset of he controls what he eats and what he doesn't, but making it available. So we just make sure it's there. And he's now remembered that that's those big bowls. And he'll ask now, "I want the big bowls of the fruit and vegetables," like Dr. Gill said.
Nice.
And so you set a good example, though. You eat that stuff, too.
We do. And that's the important part, is them seeing that it's something that's part of our routine as well, helps them as well to see that it's not just unique or different to them.
How do you explain the childhood obesity? I mean, aren't a third of kids overweight or obese? And how did it happen? I mean, there were very few kids when I was growing up in my grade school or middle school who were obese. Not true anymore.
Unfortunately, you're right, it's not. And some of that, as many of us have noted, relates to the lack of activity. So the screen time, which I know we're going to get to that part in a second, but again, more screen time, less activity, less time outside, being physically active. So physical activity is an important part. Our son is debating about what activity or sport he enjoys currently, and seems like he goes with the wind. But what I told him is he will have something that's physically active, and he can have something that's academically challenging, but he will pick something physically active. So that's what I try to encourage parents, is try to pick something that keeps your child active. And then from a diet perspective, at a young age, children have a great awareness to when they're hungry and when they're not. We, as parents often, because that's how we were raised, was clean your plate. You have to eat everything. Try to really encourage them to eat until they have the energy and they're satisfied and full, but don't make them clean a plate so that they're over full, because that's when they lose that ability to know when I'm hungry and when I'm not, or when I'm full and when I'm not. And I think that that's part of the obesity problem, is kids no longer have that awareness to when they're hungry and when they're not. They just eat to eat.
More than anything, I want to say, we're out of time and can't talk about screens, but we're not out of time. So let's talk about screens, because again, possibly not the same good routines for screens in the summer as during the school year.
Exactly. One of the direct correlators with screen time is the inability to fall asleep. So the recommendation often is to shut down or stop screen time at least 60 minutes before sleep. The other part I often encourage parents is the plugins, especially with your adolescents. Make that in the kitchen, in the office, somewhere central, not in their bedroom. Because
for the recharging thing?
Yeah, the recharging, yeah.
Okay.
Because if it's in their bedroom, even though you've told them lights out, there's a good chance that they're up texting, watching videos, doing all sorts of different things.
It's not a good chance, it's guaranteed.
Yes. So making that central location. Now, back to the habits, though. We have to model those same habits to our children. So when they see us on the screens till right before bed, or see us on screens in our bed, then they kind of question, why is there a standard for me and not for you?
Got to have a parking shelf, or a park someplace where all of the electronics get parked. And not in the bedroom.
All right, well, getting ready to go back to school. You know, it's important to get started preparing early so this school year can be as good as possible. Get a health checkup, and you talked about that. Not really many tests involved, but a conversation, physical exam, blood pressure, vaccinations, HPV certainly starting at age 9, right? For girls, 9 to 11, they get their first shot, and it only takes 2 now.
For boys and girls, start at age 9.
All right, get involved in your kids' school, know their teachers, and do the best you can to provide them with a healthy diet. One more thing.
I just had one more thing that I think is really important for parents. With your children, set goals based on effort, not on performance. So I always tell my son, did you try your best and did you have fun? Because the other stuff will figure out. The GPAs will figure out, the winning and losing will figure out, as long as they try their best at everything they do and they have fun.
All right. Our thanks to Mayo Clinic family physician, Dr. Summer Allen. Terrific. Thanks so much for being with us.
Thank you.